What can I or can't I eat and drink during breastfeeding? So there's actually no specific foods that you need to avoid if you're breastfeeding. Your milk is made from blood, not what you eat. However, some substances within food can trigger allergic reactions, and these can usually present with either skin, respiratory, or gastrointestinal problems, or a mixture of all of them in the baby. Sometimes if you notice any of these symptoms, keeping a food diary can really help so that you can try and eliminate anything that may be triggering this. However, this is quite rare. In terms of including anything in your diet, you don't need to drink milk to make milk. This is a really common myth. And the other thing to bear in mind is that milk production is made by the amount of milk removed at the breast. So you don't need to eat or drink anything specifically to increase your supply. It is recognised that you can drink alcohol and coffee during breastfeeding in moderation. In terms of how much alcohol you can drink, it's variable between each adult, and actually the best way to find out is to have a look at the information on the Lelesh League website about alcohol consumption during breastfeeding. It's really important to remember it's not the transfer of alcohol that may be the problem, but more so the ability to parent and also safe sleeping as well. If you have a vegan diet, this shouldn't impact your breast milk. However, some vegan diets can be low in vitamin B12, so it's really essential that you find out all the ways to increase your vitamin B12 to ensure that you have adequate amounts in your breast milk. Can I breastfeed if I've had previous breast surgery? So it depends on the type of surgery that you may have had and how much of the breast tissue and nerves within the breast were impacted during the surgery. So on some occasions, you may need to supplement with additional milk, but on many occasions you don't. So seeking out good breastfeeding support in the early days can go a long way. Have a look at colostrum collection during the pregnancy and speak to your midwife about this. And the other thing to make sure of is how to know that your baby is getting enough milk in the early weeks. And this will help you know how breastfeeding is going. Can I take my medication whilst breastfeeding? So in the first instance, I would be searching on the Breastfeeding Network website and speaking to your midwife or doctor about how compatible your medication is with breastfeeding. More often than not, it's actually safe to continue taking your medication whilst breastfeeding, but checking it on this website and with your midwife and GP can be really helpful to know that all is safe whilst taking it. Make sure you don't stop taking any medication until you've spoken to your midwife or GP first. Will breastfeeding cause my breasts to sag? So this really varies between individuals. It really depends on your skin type, your genetics, how much weight you may have gained during pregnancy, and how much your breasts grew during the pregnancy. So regardless of feeding, it's usually the pregnancy that can impact the breast shape following birth. When should I express my breast milk, and how can I store it? So some breastfeeding mothers never need to express their milk, but if it's something that you want or need to do, you can do this in one of two ways. You can either do it by hand, and we covered this earlier on in the course, how to hand express milk, or you can do it by a pump, and these pumps come either manual or electric. There are things out there called silicone pumps, and these basically collect breast milk. They do not pump, so make sure you're not using a silicone pump as a pump. If you're expressing, we would recommend to wait until at least 6 to 8 weeks until breastfeeding has got established. Now this can vary between each individual, but usually it's a really good time to sort of let your body decide how much milk to make and how often before introducing a pump, because this can confuse things a little bit. You may be having some breastfeeding support where your advisor has recommended that you express your milk. This is completely different because what you're doing is you're helping to increase the amount of milk that you're either making or providing for your baby. But if you're just wanting to express milk for storage and for later use, then try and wait until at least 6 to 8 weeks. There's a really good leaflet called Expressing and Storing Milk on this website. This is a leaflet that you can refer to because it talks about what the temperature of your fridge is versus how long you've got it to have in the fridge for it to be safe. It talks about room temperatures and how long your breast milk is safe in the room, and it also talks about how long it can stay in the freezer safely. If you're planning on returning to work or study, then there's a really good booklet which is very short but gives you all the information you need. This is provided on the UNICEF website under Returning to Work or Study.